Unexplained circumstances surround the mystery of a missing World War II SBD-5 aircraft after it failing to return from a routine training mission in 1943. Hello and welcome to Volusia Magazine. I'm Amber Patterson. On today's show, we'll get some new information about the continued search and recovery efforts to this day in Osteen in hopes of finding that lost aircraft. We'll also get some news from Library Snapshot Day. We'll get the latest numbers on passenger traffic at the Daytona Beach International Airport. We'll take a quick peek at QuantumFlo with reporter Joanne Magley as she brings us the business beat. And finally, Community Information Director Dave Byron will sit down with Volusia County Health Department Director Dr. Bonnie Sorensen for an in-depth interview. Those segments, news, and more coming right up on Volusia Magazine. Stay tuned. Passenger traffic at Daytona Beach International Airport continues to climb. During January, 47,074 passengers flew in or out of the county-operated airport when compared with 44,605 passengers last January. That's an increase of 6%. For the 12 months ending in January, traffic increased 4% to 632,412. Steve Cook, Business Development Director for the county-run airport, said the increase in January is the result of additional seats provided by Delta Airlines and U.S. Airways.
Well, we had a 6% increase during the month of January over last January. We had about almost 48,000 passengers come through Daytona Beach International Airport during January, up from about 44 last year. So we think it's very significant. We think it reflects the trend that our traffic is stable and increasing. This month, during the month of March, we see more seats in the market, and we think that's going to continue for 2015.
For more information, you can go to flydaytonafirst.com. The Volusia County Public Library System recently chronicled a day in the life of libraries by sponsoring Library Snapshot Day. The county's 13 library branches took pictures and collected statistics and comments showing how Volusia County residents are using their libraries on that day.
Snapshot Day is an annual event in Volusia County Public Libraries. We take all kinds of counts of what people are doing in the library, how they're using our services, even those people that are using our services virtually, and it really gives us a good idea of how impactful the libraries are in the daily life of our residents. Well, we do use the information. It helps us to be able to advocate for funding. It also helps us make decisions about what services we're going to continue to offer, what areas we need to perhaps improve in. If we find that a service is really popular and we're not providing all that we can with that service or meeting the needs of all of our residents, then we need to make some improvements. So we use it both for advocating for funding and for making improvements to our services.
Volusia County's public libraries are highly responsive to the public's changing needs. Programs introduced in recent years include e-reader classes, computer workshops, and fitness programs. This is in addition to ongoing events for children, teens, and adults. These are some of the findings Volusia County recorded during this year's Snapshot Day. More than 9,500 people visited the county libraries and checked out more than 11,000 items. The reference librarian answered more than 1,600 questions, assisted 10 job seekers, helped 17 people apply for government benefits, and helped 106 students with their homework. Nearly 1,800 adults and children took part in library programs and classes. More than 2,000 patrons used the library's computers, and nearly 300 were taught computer skills. For more information about the Volusia County Public Library System, you can visit volusialibrary.org. The U.S. Navy is conducting a search and recovery mission involving a missing World War II aircraft. The DeLand Naval Air Station Museum is working with the U.S. Navy and several other agencies in investigating an area in Osteen believed to be the site of a crash of a World War II SBD-5 aircraft that failed to return from a training mission in what was believed to be sometime around 1943. The first day of the search turned up a number of aircraft artifacts. The search team, composed of a U.S. Navy archaeologist, 5 volunteer archaeologists, a metal detecting group, and a canine cadaver dog team.
What we expect to find are more pieces of the aircraft. We know that it's been dispersed over about 200 yards, and a number of people have been out here, including property owner Rodney Thomas, and have found a number of pieces, about 300 pieces of the aircraft, and we expect to find more of those, and what we're trying to do is find enough information to identify which aircraft it is.
The previously recovered plane wreckage is available for public view inside the DeLand Naval Air Station Museum. And for more information on this developing story, you can visit delandnavalairmuseum.org.
Hello, I'm Volusia County Sheriff Ben Johnson with an important public service announcement. Don't risk your life and the lives of others by texting and driving. Put the phone down or safely pull over. Looking down for 1 second is all it takes. Is it really worth it?
QuantumFlo, a pump systems manufacturer in DeBary, has earned the title of 2014 Exporter of the Year by Volusia's Manufacturers Association. Reporter Joanne Magley has more on the company's exporting success in this week's Business Beat.
QuantumFlo is a pump systems packager primarily for domestic water pressure boosting. The company makes about 700 pump systems each year. David Carrier is the CEO.
So what we do is we take component parts and we put them together in a package system to move water from one location to another at flow under pressure. And we do that automatically. So in most commercial applications, there's a need to have water pressure constant all the time. So we actually do metal fabrication, we do pump assembly, we do controls fabrication, and laboratory testing on everything that we build.
QuantumFlo's primary business is transporting drinking water to upper levels of buildings. This is an electrical panel for a system that's going to the Time Warner building in New York City. Once installed, it will pump 1,500 gallons of water up 750 feet to the top of the buildings.
So what this system basically does is it takes water from either a city water supply that may not be sufficient, or even an underground cistern or above ground tank, and move that water to upper levels of a building, for example, or a remote sprinkler. Anything that has to do with transporting that water either over distance, whether that be vertical distance or long horizontal distances, and it does it automatically.
Carrier started QuantumFlo in 2007, but in the first 2 years, he started feeling the effects of the Great Recession, and that's when he started looking at other opportunities to promote his products.
So the first thing we looked at, the obvious scenario would be, let's expand our market share. And one way to do that was internationally. It's only a 2.5 to 3 hour plane flight from Orlando to Panama. And, so we looked at that and said, wait, we're in a very good location to jump off to South America.
Carrier also found a new client with the Department of Defense, recently building a pump system for an Army camp in Baghdad.
That's one of many systems and many activities that we're seeing crop up in Europe and the Middle East, whereas we were focusing on Central and South America. We've seen an increase in worldwide activity, and we want to be prepared when that happens, when that comes about. And of course, that's going to require us to look forward and consider adding people and adding facilities to be able to ramp up to do that.
Carrier says there are only about 6 similar pump manufacturers in the United States. One of the things that sets QuantumFlo apart from those larger companies is the software the company builds and installs in their pumps.
Because we locate all the software in one PLC or one location, the ability to transport that data very, very rapidly improves the resolution of the pressure we can control. So the faster the operation of the program, the better the pressure control. So we can control the pressure of the discharge of that booster within plus or minus 5 psi on maybe a 150 psi system, which is very, very tight. We compete with the likes of Fortune 500 companies. So we're competing with the big boys. We have to bring something to the game that is a superior product, superior technology. In our case, we bring that with our software technology. It was awarded 2012 Innovation of the Year by Pumps and Magazines, which is the software that controls these pumps.
In addition to being named VMA 2014 Exporter of the Year, QuantumFlo was named in Grow Florida's 2014 list of companies to watch. Since 2012, the company has doubled in size. In 2014, it grew 45%, and Carrier says he expects the same growth for 2015.
I actually believe that there are 2 key things that make us unique. Obviously, number one, without a good product, you're not going to get success. The market sees the product and they purchase what they think is good, right? They purchase the product they believe to be of high value. That's important. And the second most important thing is right here locally, is just the quality, the people. The people are who we are. If our people don't care about what they do on the shop floor, that gets translated into a product that's not as good as everybody else. So without the collective effort of everybody in our organization, we can't be as great as we want to be.
For the Business Beat, I'm Joanne Magley.
Around the state, volunteers visited elementary schools to read Sunnybell's Florida Dairy Farm Adventure, a book developed by the Dairy Council of Florida. Afterwards, the volunteer readers donated the storybook to the class. Here in Volusia County, Dr. Bonnie Sorensen said employees with the Volusia Department of Health in Volusia County stopped by Westside Elementary School in Daytona Beach to read to kindergarten and first graders. Stephanie Strong takes us along to the Westside Elementary School for a story time in this segment of Community Health Matters.
Where does it come from?
It comes from the store.
The store, right? Then we should go to the grocery store, Clyde says. That's where my mom gets our milk.
The Florida Department of Health in Volusia County proudly participated in Celebrate Literacy Week Florida with Westside Elementary School students in Daytona Beach. A number of employees, including Director Dr. Bonnie J. Sorensen, stopped by the school to read a story to kindergarten and first graders.
And we are so proud to have you at Westside, Dr. Sorensen. Can we say thank you, Dr. Sorensen? Thank you, Dr. Sorensen.
Principal Judy Winch appreciates the developing relationship between the Florida Department of Health in Volusia County and Westside Elementary. The annual volunteer reading event helps motivate children to read.
Well, the partnership with Volusia County Health Department is amazing in that it's not just about reading, but you help us in so many different areas. And this partnership has grown over the past few years, and we're excited about that growth. But today is extremely important because to us, reading is at the base of all educational success. And you know, the children see the principal reading, they see the other children reading, they see their teachers reading all the time. But when we have individuals from outside the building and our celebrities that come on campus to read, like Dr. Sorensen from the Volusia County Health Department and others, it just makes the children see that, gosh, it's not all about us reading. It's about there's adults that read all the time, and they're taking their time to come to visit us and show us the importance of reading.
Westside Elementary School students enjoyed the adorable story of Sunnybell, a very curious calf who lives on a dairy farm. Sunnybell realizes that her most significant job is to teach others about the importance of drinking nutritious beverages like milk to provide energy for physical activity and healthy living.
We in health realize that literacy, the ability to read and the ability to understand what we read, is extremely important in life, but also related to health. If folks don't understand their illnesses, don't understand the treatment of their illnesses and how to make themselves better, they're going to be compromised the rest of their lives.
In a continued effort to promote the connection between reading and health, the Departments of Health, Agriculture and Consumer Services and Education are pleased to partner with the Dairy Council of Florida on this Health Literacy in the Classroom volunteer reading project. Volunteer readers were asked to visit pre-K, kindergarten, and/or first grade classes around the state.
I enjoyed the experience. I think all the children did too. They really enjoyed the talking milk and the exciting journey that Sunnybell went on.
It was great. The kids are fabulous. I love reading to them. Did this last year, had a great time, and this year was just as much fun.
I enjoyed reading to Miss Dixon's first grade class, and it was most enjoyable for me because they asked questions after the book, and to top it off, I went to Westside Elementary when I was little.
Creating a fun experience for children and adults to help further their health is just one way to achieve a personal healthy weight and ensure that our state has the healthiest weight in the nation. Some students presented thank you cards to the readers.
Well, it definitely was fun. First time experience doing this. The kids were very into the reading. I asked a lot of questions. I read to 2 classrooms. The second classroom, I made cards for myself. This card was actually by a young girl. She has grapes and bananas and oranges on the front. She stated that, thank you for reading to us. We love having visitors.
The only reason we are in school is to learn. Oh my goodness, thank you so much.
For Volusia Magazine, I'm Stephanie Strong, Public Information Officer for the Florida Department of Health in Volusia County.
Time now to head into the studio to join our very own Community Information Director, Dave Byron, as he sits down with Volusia County's Health Department Director, Dr. Bonnie Sorensen.
Well, thank you, Amber, and hi, everyone. Well, you know, Volusia County and the state of Florida are losing one of the state's top public health officials this spring when Dr. Bonnie Sorensen, the director of the Volusia County Health Department, retires after a long and distinguished career in public health. So today we'll get Dr. Sorensen's thoughts about the state of public health in Volusia County as she prepares for a well-deserved retirement. Dr. Sorensen, how you doing? Thanks for being with us.
Great, Dave. Thanks for having me.
I guess we all reach the point in our lives when we get ready to retire.
It's about time, right?
You've reached that point, so congratulations.
Thank you.
On really what truly is a very distinguished career. Let's talk a little bit about your career, about your background. I know you were a private physician, and then you got into public health, and you got into the state of Florida, and then you went to California and came back. So give us just a quick history of
Yeah, I've had a little bit of a zigzag career. I started out in private practice, as you mentioned, as a endocrinologist, which is a specialist in hormones and particularly diabetes. Half of my private practice were diabetics trying to figure out how to manage their illness. And
a serious illness too.
Very serious and time-consuming and labor-intensive and expensive. So half of my practice, half of my time was spent really trying to educate diabetics on how better to manage themselves to improve their quality of life as well as their diabetes. And over a period of 10 years or so, I realized that I very much more enjoyed the educational part of my private practice than the treatment part, running around in the hospital trying to save people. So when I got out of my private practice, I was looking for a way of utilizing the skills I had, but also the love that I had.
Right. And so you got into public health, and you were the Volusia County Health Department director, and then I think they yanked you to Tallahassee to straighten them out up there.
Yeah, well, I started at the health department as a physician in the clinic, and
yeah, you were a specialist,
right? Spent a number of years taking care of patients in the health department, including a large panel of HIV patients. Then I became the director for half a dozen years, and then I went to Tallahassee for half a dozen years, and skipped over to California for a couple of years, but then fortunately
straightened out California,
was able to come back.
And then you came back, and really, you know, as we look at, you know, the position here in Volusia County, you know, a county health department director really is in the community. It's really a key position in the community, and you get to really make a difference in the community that you are employed in, and of course you're a resident here. So.
Exactly. That's been one of the more satisfying aspects of the job. I mean, certainly there's the science and epidemiology, infections, and that sort of thing, but the most satisfying part of the job is really working in the community, working with partners, and trying to synergize together to make the community more healthy.
So, you know, as you get ready to leave, let's get your view from a broad, big picture point of view. I mean, healthcare is in the news every day of some format or another, and then of course you have the Affordable Health Care Act that's come into play, and you got debates about that and insurance, and I mean, it's really, this healthcare thing is become so complicated, at least it is for me. I'm not sure people even understand how all of these pieces fit together. What do you see when you look at the national picture?
You're right, it's very complicated, and part of the fun of my job is trying to understand the system of healthcare, what system we have. Certainly on a national level, it's a huge budgetary item, you know, multi-billions of dollars, and as each of us get older, we understand why, because we're requiring more healthcare. But we're also, on a national basis, we have 50 different varieties of healthcare systems in different states, and Florida is unique in itself.
And we've seen just this year, Dr. Sorensen, how healthcare can become on a worldwide stage. You know, we've had the Ebola scare, and you know, with people now being so mobile and traveling through aircrafts and all of that sort of thing, this whole infectious disease thing is kind of more, maybe it's come to the forefront more.
It is more in the forefront, but it's also because it's more prevalent. Any illness, any infectious disease can be one plane ride away. We had Ebola. Now the entire country is concerned about measles popping up in different states, and you know, one of the values of public health is that although an individual physician will take care of the person who has the infection, that physician is not necessarily responsible or feels obligated to take care of everyone else around that particular patient that has been exposed. And public health's role is not only to track all those infected people, but to make sure that everyone around them that may have been exposed is protected.
Let's look at the Florida level now. You've been in the Tallahassee level, you've certainly been at the local level. When you look at the healthcare picture in Florida, what are some of your thoughts there?
Well, Florida, you know, has the reputation for being one of the oldest states in terms of the number of elderly in our state. We're really a mecca for retirees, and therefore we are really an insurance company bonanza and a pot of gold for providers. So we're fortunate for that reason that private sector, private practice is attractive in Florida because of the number of elderly and the level of those insured people. The flip side, though, is the fact that we have so many uninsured folks in Florida. We are a very diverse state. We have lots of folks who are not legal citizens and therefore don't qualify for insurance. So we have you know, the pros and cons in Florida.
All right, so let's look at the lens in Volusia County. You know, I've got to ask you about the fact that the Robert Wood Johnson Foundation at the University of Wisconsin, I guess now going into the 5th year, has taken a snapshot across the entire United States, every county in the United States, and of course Volusia County is judged with the 66 other counties in the state of Florida, and honestly our ranking is not all that great. I mean, what are your thoughts about the healthcare?
It's not all that great. First of all, the ranking of Florida amongst 50 states is not all that great, and the ranking in Volusia is not all that great compared to all the other 66 counties. You know, why do we have problems in Volusia County? We have actually an excellent, robust healthcare system here in Volusia with 5 major hospitals, a level 2 trauma, medical schools, nursing schools, hospital taxing districts to pay for care for the Indians. So from a clinical perspective, from a healthcare perspective, we actually are very robust. But from a socioeconomic perspective, we are very under robust. We don't have enough kids graduating from school, therefore they may not have job opportunities, they fall into poverty, they may fall into crime or other nefarious activities. So all those socioeconomic factors influences a person's health.
Which prompts the obvious question, as you have thought about it. What do you think Volusia County needs to do to kind of improve our ranking?
Well, I think it's all about higher paying jobs. Obviously, our schools need to be supported. Our schools are underfunded, not only from a state perspective, but compared to other counties around us. So that needs to be a priority. That's job number one, getting kids educated. Job number two is having decent jobs for the kids who do graduate, to keep them home and have benefits. We are pretty much tourism based, so despite the fact that we may have all sorts of cranes going on in Volusia with economic development, unless those are high-paying jobs, then we're just kind of continuing to be on the treadmill of having folks who have no benefits and low-paying jobs and therefore socioeconomic problems.
So when you look at Volusia County's socioeconomic healthcare problems, it seems to me, and you and I have talked about this many times, the behaviors in the lower income neighborhoods are not where they need to be. I mean, is that basically a way to boil this down?
I mean, certainly there's a trend for that. Our behaviors also impact our health, whether we smoke, whether we eat right, whether we are physically active, whether we binge drink. As it turns out, if we look at any of those risk factors, the higher educated a person is, the less likely they are to have those risk factors, and the less educated a person. So it's not ethnicity or racial, it's really education which impacts everybody in the community.
As you get ready to leave the Volusia County Health Department, as you look at your agency itself here in Volusia County, we're in pretty good shape as you leave, you think?
Yes.
I don't think you'd say, well, I'm leaving.
No, not at all. No, we're very strong. As you are aware, many of the employees of the health departments are scientists. We're doing communicable diseases and epidemiology. We're doing environmental health. We're doing limited health care, such that we have nurses and doctors and veterinarians. So our health department is very strong, really because of the people.
And as you look at the role of the health department, it's evolved and it's changed like everything else. What do you see the role of the public health department these days?
Going forward, public health is kind of shrinking its personal one-on-one medical services, otherwise considered primary care, but expanding its role outside the walls of the buildings, expanding its role in trying to invest in community. What projects can we synergize, leverage with other community partners to improve the conditions, the environment in which we live, that ultimately will make healthier choices easier choices for everyone.
Well, Dr. Sorensen, I want to thank you very much for being with us. You've been a great partner with Volusia County, and certainly want to wish you all the best in your retirement.
Yeah, it's been a pleasure, Dave.
Our guest today, Dr. Bonnie Sorensen, the director of the Volusia County Health Department. And with that, Amber, we'll go back to you.
Thanks, Dave, and thank you for watching Volusia Magazine. If you have any questions about the show, you can feel free to give us a call at any of the numbers you see listed here, or you can log on to volusia.org and click on the News tab at the top of the screen to find us. Incidentally, you can find the County Council's meeting calendar there too. In fact, you can use volusia.org to find out about meeting dates, workshops, topics of interest, activities, and how you can become involved. And we hope you won't forget to listen to Volusia Today. That's Volusia County Government's weekly public radio broadcast. Volusia Today airs every Tuesday and Sunday mornings on the local radio stations you see on your screen. For Volusia Magazine, I'm Amber Patterson. Have a wonderful evening.